today I'm going to be showing you how to create or obtain a 24-hour urine specimen. So the supplies I would be getting is a urine hat, a basin, and a sign to put on the door, and it's specifically important because once you start your urine specimen test, you're going to want to put the start date and time and the end date and time on the patient's bathroom door, because if someone else besides yourself as the RN, like the nurse assistant, is bringing your patient to the bathroom, then you're going to want them to see this and know that they need to adhere to the test. So if you put this on the patient's door or the bathroom door, just as a reminder, and then the first urine of the morning would actually be considered old urine, so we would discard it because that's urine that has been like accumulating over the nighttime. And then the second urine of the day would be considered the first. So after that one, that's when you would put the start date and the time, and then 24 hours from then would be when you would stop. So basically, after I have all my supplies, I could go in my patient's room and just explain my procedure. So, hi, my name's Naomi. How are you today? Good. Can you give me your name and date of birth? Naomi Rascovi, 6499. Okay. So, today I will be doing a 24-hour specimen collection from you, from what the doctor ordered, and basically what it will measure is your glucose, your ketones, adrenocorticosteroids, and amino acids. And so basically every time you have to go to the restroom today, we will be collecting it from a urine hat. And so just let me or do your call light button or the nursing assistant know when you do have to go to the restroom, so we can make sure that we get all the urine within 24 hours. That sound okay? Okay. So basically, if a patient was mobile, it could be a clean procedure because I could easily get my patient up from the bed, bring them to the bedside commode, and when I set them on here, there would be a urine hat for them to urinate into, and I could easily, once I put them back in the bed, pick this up and discard it into the basin. And once I do have my first urine test, I would label this with the patient's name, the start date, and the time. And according to hospital policy, I would either leave this in the patient's bathroom or I would refrigerate it in between each urine collection. But that would be if the patient was mobile. But yeah, and if they were immobile, I'd have to do a sterile procedure and either use like a straight cath or maybe from their catheter bag, and I would have to obtain the urine that way because they wouldn't be able to get up and come to the bedside commode. And so after I have all 24 hours of my urine collected, I would send this off to the lab for them to test for the amino acids, adrenocorticosteroids, the ketones, and the glucose. And basically what the findings could possibly be is if you have high glucose in your urine, that could be from pregnancy, diabetes, or a rare condition called renal glycosuria. And that could be if that happens, you would need to let the provider know, like as the nurse, so further testing can be done because it can be dangerous and life-threatening. But if you have high ketones in your urine, that could indicate diabetic ketoacidosis, and that also could lead to coma or death because it's like secondary to diabetes. So you would also need to notify the physician so he can go with further testing and figure out what he wants to do from there to help your patient. So basically that's all. And a way that I would put the urine into the basin is once the urine is collected, I would easily just use this funnel to pour it into there. And then this holds 3,000 milliliters. And so within 24 hours, I should be able to fill this up from the patient. That's all.
So today I'm going to be talking about collecting urine and straining it for kidney stones. So I'll have all my supplies here. So you would use a urine hat if they are mobile, a bedpan if they're not. I have a urine specimen cup, a funnel, and then another specimen container, and a biohazard bag. Okay, so now I'm just going to walk into the patient's room and explain the procedure. So, hi, how are you? My name is Courtney. I'll be your student nurse today. Could you please tell me your name and date of birth? Alright, Courtney Benoit, 5/29/98. So today I'm just going to be collecting some urine from you and straining it because I've heard that from the doctor that he thinks you have kidney stones. So we're just gonna see if you do, and if you do, then I'll take your urine sample and strain it, and we can send it off to a lab, and the doctor can determine what the best treatment for you is, and how we can prevent this from happening in the future. Alright, so this is a clean procedure, and since the patient is mobile, they can use the urine hat. So this would just go in the toilet, and then I would have them urinate in it and notify me when they do so I can collect it. Alright, so once I've collected the urine, I would just take it into the funnel and collect all of the urine. So then any kind of kidney stone would filter into this. So then I would use another container and then take any kinds of stones and put them into there. Then I would cap it and fill out the information. So I would label it with the patient's name, the date, the time, the room number, their doctor, and then I would take a biohazard bag and I would put the specimen into there, and I would put like the patient's name, their date of birth, the room number, the date that it is, and the time that it is. Alright, so I collected the specimens, so I'm going to send this off to the lab, but then we can determine what kind of interventions that I could do to help you. But for now, I could see if we could get some analgesics ordered. I could help you walk around or put you in, or help you get in more comfortable positions, and keep you hydrated would help. We could elevate the bed for you, and